Just thinking about the profile of our patients or our clients, they have definitely greater consumer awareness. The baby boomers, active consumers that are exercising choice. And that is very obvious in terms of the types of services that people are now demanding, where they want those services to be provided, and in the time frame in which they want them provided. Maintaining functional independence, people have already talked about, in terms of being independent in your home and managing your own healthcare, is increasingly the focus of the way we provide care. And technology and advancements in the way we deliver care is actually assisting that at quite a rapid rate. I just don't think we've quite drawn breath to actually understand that in depth at the moment. Our service policy, things that we're focusing at the moment, definitely is that patient-centred choice, what that means to a system as large as New South Wales Health. Engaging patients in the management of their own health and well-being, and obviously in New South Wales that's a major focus for us as an organisation, because our health promotion, our population health services are all wrapped up into the one organisation, as is our community health, as people were referring to. Meeting complex demands for chronic disease and comorbidities within community settings is one of the major strategies that we have underway at the moment, which was launched a year or so ago, is about managing chronic disease, severe chronic disease, and how best to do that. And there's a whole range of new roles being put in place around setting up call centres, doing health coaching for people with chronic disease, to assist them to stay in the home, to keep them out of those emergency departments as much as we possibly can. In terms of what that means for workforce planning and development, obviously we have to look at our workforce from the service design needs that are ahead of us. So it's been clearly identified in the environmental scan. That's about prevention, primary care and acute care. The challenges, some of the challenges that we have ahead of us, is trying to work out the number of health professionals, the technical and the support workforce that are required to provide that service. As is already indicated, the distribution of service and the location of that workforce is absolutely critical to the way we plan that workforce, how we go about recruiting it, how we go about training it. The cross-disciplinary practice, be it called multidisciplinary or interprofessional, those terms all tend to merge together. But what does that actually mean? It's quite a challenge, as has already been identified, for a traditional workforce that's been structured along expert lines to really come to terms with what does cross-disciplinary practice mean. New and expanded roles and skills. Again, we've already raised that as something that's moving ahead at quite a rate. But what we find is we expand the roles, we add new skills, but especially in the more traditional professions, they don't want to let go of what they've been doing. Now that's quite understandable, considering the training that sits behind those professions, but it doesn't make much sense in terms of how you deploy your workforce, how you can best use highly trained, highly skilled professionals. We don't necessarily want them to be doing a range of tasks that could be done by a different category of worker with training. And obviously new technologies and care models are making a considerable impact. If you just think back in terms of being able to manage renal conditions now in the home, as opposed to having to always come into a centre for dialysis. In terms of the traditional expert model, now in rethinking a person-centred care approach to delivery, the expert model doesn't fit very comfortably. you want to have much more say from your patient. So that crosses through the way we, the culture of the organisation. Importantly, the undergraduate preparation, that education about training them to be professionals, has to be challenged. We have to bring that flavour into what they're getting in an undergraduate, and then in their orientation to the organisation and ongoing professional development. The expansion of professional scopes of practice is something that we're definitely seeing across a range of professions, including enrolled nursing, the Div 2 in New South Wales. One of the other challenges that we face that needs a little thinking, especially as we go to national regulation, is balancing community safety with flexibility of a workforce and cross-disciplinary practice. There is a great push at the moment by a number of professions that aren't currently registered to be registered. In terms of that registration push for professions, we just have to keep that clearly balanced. Why do we register professionals? We register them to keep the public safe. We don't register them for the prestige of the profession. And we don't register them for an increase in wages. So, in terms of the safety issue, the test is how much of a risk is that that profession undertakes to public safety. And there are many ways of regulating, registration being one of them. My word of warning on the great push to registration is that it potentially makes your profession considerably less flexible, and it makes our workforce considerably less flexible. It definitely does provide that high level of risk management. There's no doubt about that. But the flexibility issue, it sets very clear boundaries. It entrenches, it has the possibility, and history shows it, of entrenching the silos. So we need to think very carefully, and if we're truly going to cross-disciplinary practice, I'd say we need to have a rethink of some of those, the way some of those professions are being registered and regulated in other ways. In New South Wales Health, and probably in the whole of the health sector, there's poor coordination across the acute and primary health areas. We are trying to address that, and the latest round of initiatives by the Commonwealth is having definitely a challenge at trying to improve that coordination. And then another query is the demand for services. Is it patient-driven? Rethinking the role of person-centred healthcare. Is the demand for service patient-driven, or is it profession-driven? Is it medical advancement-driven? Is it technology-driven? Or the other question, which is often raised in our forums when we talk about workforce planning, is it actually driven by the incentives that pay for healthcare, such as Medicare? And I won't go into too much more on that issue, but there is pretty strong opinions around that we need to have a good look at that.